So how the coronavirus affected me, through this time I'm still working, which is a good thing. A lot of people aren't. It's kind of sad to see a lot of the local businesses that have been impacted by this, people on line for food at the food banks. It's quite alarming, something I've never expected to see in this country, or at least haven't seen in a long time. For me, I'm an operations director for a medical oncology company, and our staff, our team, we're still out there servicing our customers' needs. And our customers' needs are helping those patients that have cancer. Cancer patients are still going into hospitals, cancer centers. We've definitely learned through this that cancer doesn't stop for COVID-19. And since cancer doesn't stop, neither can we. The equipment that provides the radiation therapy treatments to the patients is needed to be available and needs to be running for them to get their treatments. There's absolute clinical reasons for the continuation of their treatments. So our staff, has to be out there and helping the patients. So the impact of that is, we've switched from a scheduled service model to an emergency service model where we're only going out to try to limit the exposure of our patients, of our staff, I should say, to the patients. Initially, we had, before the PPE became available, we had several folks that unfortunately were exposed to the virus while at work, and there's a great impact, to me personally. We sent those folks, out for those calls. They understand the mission that they have to do, but at the same time, there's a concern of bringing, the virus home to their family. So, we now have PPE for them, masks, gloves. There's particular decontamination and sanitizing practices that are in place on all the equipment that we have, and we're in a better place than we were a month ago. Being in charge of the entire Northeast, the epicenter of this being New York City, that's where we had the largest impact. There was a day when we lost 4 service engineers that had to self-quarantine for exposure to a medical staff member who ultimately tested positive, and that was before PPE was widely available. So all 4 of those folks, were sidelined for 14 days, impacting their coworkers. Their coworkers all had to pick up the slack and cover their calls for them. Thankfully, none of those folks got sick. For me personally, the impact of this is difficult. I have elderly mom. I can't go see her. My sister, who's got some pre-existing health conditions, we can't see her either. We speak on the phone, and there's only so much that you get across with that. That's been one of the more difficult aspects of it. Thankfully, from a standpoint, we have everything that we need. We can't necessarily get everything that we want, but we have what we need, and that's what's really important. The things that you need are secondary to, sometimes to other things. But outside of that, I'm just thankful that everybody's healthy. We'll get through this. I'm sure we can. The impact is still immeasurable. Don't know what the financial future of a lot of businesses are going to be. The company I work for, we're taking on extraordinary costs at this time. Hopefully the business can support that going forward. But it's been something that I never would have expected in my lifetime. A global pandemic, hitting us. It's strange to see people in the U.S. walking around with masks. We always thought that was over there, but now it's over here. It's real. So that's my story. Thank you.